Millions of the people in the U.S. deal with oral pain and intense fear, but oh my God, I have a whole story to tell you guys. But many people just ignore their symptoms because they're terrified of the dentist.
Yeah, and officials say oral health in U.S. adults hasn't changed much over the past 2 decades. About 90% of adults between the ages of 20 to 64 have some tooth decay. Nearly half of adults between 45 and 64 years of age have gum disease. Some may dismiss the tooth pain due to lack of insurance or fears, as about 1 in 4 working age adults don't have it. Others may dread getting care. About 1 in 5 adults have moderate to high dental fear anxiety. So you're not alone, Alex.
The fact that people say that root canals are painful is really a myth. If you need a root canal, don't be hesitant to go.
And the National Institutes of Health say certain behaviors put oral health at risk. That includes consumption of alcohol, tobacco, and opioids. The agency says this can lead to oral cancers, diseased gums, and tooth loss.
Going to the dentist can be scary, and not just for adults, especially our kiddos, but taking care of their teeth and teaching them the importance of dental health at such a young age is vital for their general health.
And February is National Children's Dental Health Month, and because caring for our kids' teeth can be a challenge, we are excited to have Dr. Quintanilla, also known as Dr. Q from West Metro Pediatric Dentistry, to lend your expertise. First, thank you for being here. I know you brought your little friend.
A little friend, I know.
Those teeth are killing me.
Yeah, I know. They look very clean and healthy, those teeth.
Are.
So first and foremost, what is your recommendations and steps to make sure that our kids are taking really great care of their teeth?
Yeah, it all starts with parental assistance, and at home, it's really important that parents are helping their kids learn how to brush their teeth. A lot of it is education, and so it's really important that we're brushing twice a day. It's what I call the rule of 2s, right? So twice a day for 2 minutes in the morning and at night. In the morning, we're really busy and we're trying to get out the door, but it's about instilling those healthy habits and routines. So that way, whenever they're older and we expect them to do it on their own, it's just something that they've learned to do because their parents have taught them. So brushing twice a day in the morning and at night for 2 minutes, but really important is also flossing your teeth at night.
My kids need to get better about that. Is Ava really good at the flossing?
Well, she loves the dentist. She loves it's insane, but because she has an incredible one who she loves going to. But I have a question for some of us with younger kids. My youngest is 2, and she loves the tooth. She just sucks the toothpaste off of the brush, but should you still be helping? What age do you guide the kids, and can they kind of handle it on their own, and the flossing too?
Totally, yeah. So flossing we recommend whenever the teeth start to touch, which is usually around 2 to 3. I always tell parents, get a kid-friendly tooth or a floss pick that's a colorful one, one with a fruitier flavor. Makes it a little bit more engaging for them, right? So that way they can pick out the color or pick out the flavor, and they floss the front teeth. And I always tell parents, you help them out with the back ones, just to help them out, get all the way in the back and get those in-between spots that are really hard to clean. But a good rule of thumb is usually 7 to 8 is an average age where kids can brush their teeth on their own, but every kid develops differently. So typically we talk about whenever they're able to adequately tie their shoes on their own, then they're able to have the manual dexterity to do it on their own as well. And there's little things that we can use at the office to kind of teach them, but I still recommend parents helping them out with them as they're learning.
For my 8-year-old.
You do?
Oh yeah, I'm let me get in there, girl.
Oh man, okay, I need to be helping
Now
my
that she has
almost
braces,
6-year-old. I feel,
I'm in
even
there.
more.
You told me to get an electric toothbrush. Got her.
Oh yes, yes.
What are the biggest culprits for cavities and tooth decay?
Yeah, so the food that we eat, right? And so one of the biggest ones is going to be the sugary and the sticky candies, right? Or the sticky snacks. Fruit snacks is one of the biggest culprits. Goldfish, things that are those carbohydrates that just stick to your teeth. We as adults will use our tongue to try and get it out of our teeth. Kids will just let it sit there and they let it soak until it causes a cavity, right? Oh, wow. And so it's really important to try and avoid those really sticky things. But the other one is juice. Juice and the constant exposure to soda or sugary drinks. So we really recommend a lot of water. And really, it's not the amount of sugar, but it's how much they're eating throughout the day or drinking throughout the day. So if you're sipping on anything throughout the day, we highly recommend it's just water, and limit any sort of milk or juice to just meal times. And so that way we're not snacking or sipping on things throughout the day that have this constant exposure to sugar to your teeth.
Good advice. We know you have a big event coming up February 6th, and we want you to talk about it, but I can't stop looking at your friend.
I know,
Could you please explain who this is?
I know. So this is one of our friends that we have at the office, and we use these a lot to show the kids and show them how to brush their teeth and the angle of the toothbrush and really hitting on the gum line. So these are really good tools that we use in the office. We have like a comfort menu item that we have like a weighted blanket, or if it's a stress ball or whatever that they can use.
Are you kidding? Evil
Laughing
woman.
gas,
No,
everyone's
no.
best friend, right? So things to make it a lot easier for them. And so at a pediatric dental office, it's all about, kids have like the fear of the unknown. And so it's just teaching them and guiding them through it. So that way, whenever they start really young, they love coming to the dentist, right?
I love that. And your big event, before we go, we have like 15 seconds.
Yeah. So this is on February 6th. It's called Give Kids a Smile Day. It's where we provide free and preventative dental health care education and services to all the kiddos in Colorado that are underserved and maybe don't have insurance and are not able to get any sort of dental health care outside of that. And so it's at our office, and a lot of professionals are providing it, so feel free to call us.
That's amazing.
That's huge.
Yeah.
Thank goodness for you.
I know.
And these incredible pediatric dentists out there
Thank
who are
you.
not traumatizing children, but making it a good, happy,
true.
safe
Thank
place.
goodness.
It's
Yep.
amazing.
Yeah.
Dr.
Well,
Q.
I appreciate it.
Thank
you. Guys.
you.
Thank you. Appreciate
Nice to
you.
see you.